Here at 4545 42nd Street in Washington, D.C., the theory and practice of psychoanalysis is alive and well. My name is Tarpley Long, and I am a graduate of the Institute under the Washington Center for Psychoanalysis. The Washington Center for Psychoanalysis draws mental health professionals from medicine, psychology, social work, nursing, and the humanities, as well as community members. Our mission is to train psychoanalysts and psychoanalytically informed psychotherapists and to reach out into the community through teaching, research, interdisciplinary study, and the provision of affordable clinical services.
What training has done for me is many things.
I grew personally as an analyst and also professionally in ways I had never imagined.
It really did help me become a confident clinician and to feel very passionate and engaged in my work.
I've found myself developing a stronger and stronger identity.
Analytic training allows clinicians to be more open to understanding how others are relating to us.
It's really affected my life profoundly in every way.
Psychoanalytic training is based on a tripartite model consisting of 4 years of coursework, individual supervision of 3 required analytic control cases, and a personal training analysis. The coursework is based on a multi-theoretical curriculum. In addition to reading Freud, Melanie Klein, and Heinz Kohut, candidates also read a diversity of contemporary theorists such as Tom Ogden, Jim Fasagi, modern Kleinians such as John Steiner, and authors from the American Relational School such as Mitchell, Aaron, and Benjamin.
Class size is small.
My teachers, who were analysts, were the most passionate teachers.
It's very much an interactive type of teaching.
I find teaching probably is the way that I learn better than any other way.
If we were talking about a hard case, they seemed to get more engaged and more curious about the case rather than getting frustrated or burnt out.
If you have to teach something, that means you really have to understand it. And you also learn from your students.
They really want to learn so that they are prepared, they contribute a great deal, and as a result, we all get something out of it.
Supervision, each candidate will meet with the supervisor and speak with him or her once a week about the cases that they have in analysis.
I've come into a few patients who were really stirring me up and giving me kind of a lot to worry about, along the lines of really the dynamics between us in therapy sessions, so they weren't in analysis. I needed to talk with someone with a solid analytic background to help me understand the back and forth that I was feeling internally and find some way to bring that back into a useful approach with these patients.
I think applying analytic thought and my own psychoanalytic understanding to patients that for whom analysis really isn't the treatment of choice for a variety of reasons really deepens the work with those patients and is extremely useful.
I was so impressed with how much they knew and how they were able to use this knowledge to work with these patients and help me work with these patients.
A personal analysis for someone in psychoanalytic training is the same as any other analysis. It's intended to help one know oneself as fully as possible.
Analytic training has helped me to appreciate the various transformative moments in my life.
I feel like it's helped me to be very present as a father and as a husband.
It's affected my life outside of my work. It's like I always wear a psychoanalytic lens when I see things.
It also offers you a community of like-minded individuals.
It has informed all my work, not just as an analyst, but in psychotherapy, and I also treat couples and families, and it's the best decision I made was to do training.
It just makes life a lot more interesting.